Good morning, everyone. You're welcome to Ask the Pediatricians Live. We're sorry we're starting a bit behind schedule. This morning we're going to be discussing a very interesting topic. The topic for discussion this morning is dangerous childhood practices. My name is Gbemisola Boyede. I'm the moderator for this morning's discussion. I have with me in the studio Dr. Gbemisola Boyede. She's a pediatrician and the founder of Ask the Pediatricians Group. So, Dr. Gbemisola, you're welcome.
Thank you. Good morning, everyone. Thank you for joining us this morning.
So, Dr. Gbemisola, I'll be asking you this morning, what exactly do you mean by dangerous childhood practices?
Okay, so when we're talking about dangerous childhood practices, we are talking about practices that are quite commonly practiced, especially in this part of the world, as far as child health is concerned. Many people take it as the norm, but unfortunately, some of these practices actually cause death or sometimes illness to children, and this is the reason why we need to discuss them so as to enlighten people to know and to desist from these practices that can lead to the death of our children. Because as you know, our goal, our mission at Paediatricians is to improve your child's intelligence, and that's why this morning we're going to talk about those practices that we all do but which are actually very dangerous for the health of our children.
That sounds really scary. Maybe you need to give us examples, because you've mentioned death and I'm really beginning to wonder how this will play out if we don't take caution. So please give us examples of this practice.
Okay, so I would like to start from, we can even start from pregnancy, but because this is child health, I would want to limit myself to children. Right from the time the children are born, we found out that there are lots of practices in the newborn period, what we call neonatal period, that affect the health of our children. These practices vary from how the child is taken care of in terms of birth, how the cord is being cared for. Some people also talk about tongue tie and they need to cut it, and then some other drugs or herbal remedies that are given to children. And these are various things that people do as routine thing, and unfortunately they are impacting negatively on the health of our children. So I'm going to take each of them one by one and talk about what people commonly do in those areas and the negative effect on our children. And it's even beyond the neonatal period. We have the issue of use of things like palm oil when children are taking wrong or poisonous substances, and even the use of female circumcision, the use of medication indiscriminately, especially antibiotics by mothers. These are many practices that mothers do routinely, and unfortunately we as pediatricians, we are the ones that tend to receive these children and see the negative repercussion on the health of our children. So we're going to go into each of them in details so that mothers will learn, and hopefully we hope that this will lead to the end of these practices.
Thank you very much.
Yeah.
So maybe we should go in bits. We'll take each of the subtopics one by one.
Okay, yes. Yeah. So let's start from when a baby is born. I found that in this part of the world, people just believe that when a newborn is born, the child must take so many medication, and they practice what we call Ajogba syndrome. Have you heard of Ajogba syndrome? So Ajogba syndrome is a situation where the mother gather all sorts of drugs for the newborn baby. You have ampiclos, what else you people put there? You have Nospami, grape water, Infocol, and all sorts. And once the baby is, after the birth of the baby, the first thing they do is to give this baby all these medications. And I'm here to tell us this morning that a newborn baby needs no medication. You can quote me. A newborn baby does not need any other medication. All that a newborn baby needs is just breast milk. So a lot of people have asked us on Paediatricians that I must give ampiclos, I must do this. I'm telling you that these drugs are not necessary. And unfortunately, these are the kind of medication people give to the children that breeds what we call antibiotic resistance, and some of these medications, they all have side effects. When a newborn baby is born, all that the baby needs mostly is food, breast milk, and of course to be kept warm and clean in an hygienic environment. If you maintain that, the newborn baby is fine. And that reminds me also, when it comes to feeding the newborn baby, we all know that breast milk is the best, but one of the common practices people also do, which is dangerous, is the giving of water to newborn babies. So you see a lot of mothers believing that, especially our grandmothers, they believe that if you don't give water, it's like somebody, you adults, when you eat, you must take water, and they believe that, so when baby is also taking breast milk, they must take water on top. Now I'm here to tell you that breast milk is 80% water. So God in his infinite wisdom has already put the water and the food together. So you don't need to give water. And this is very dangerous. Why is it dangerous? Because in our own environment, we don't even have access to good water. And so many mothers are the one introducing germs, causing diarrhea, causing all those things to their newborn babies through giving water. In fact, there was one scary experience we had in Luz. A grandmother wanted to give water and she mistakenly gave kerosene. We lost that baby. And I was just like, if there is no need to have given this baby water in the first place, I mean, we won't even be talking of making a mistake of giving kerosene or the baby dying. And we have seen babies, anytime you see a newborn baby having diarrhea, most times because either the mother is giving water or giving formula, because babies on exclusive breastfeeding they don't tend to have all those illnesses. So when it comes to feeding, a newborn baby does not need water. Only breast milk, no agbo, nothing. Because some also give, apart from those who do ajagba, which give normal drugs, some people also give upper concoction, agbo nuwo, agbo this, agbo all that. These babies don't need anything. And some of these things are the one creating problems for our baby. So we're saying, please do not give them any of those things. And if we move on, we talk about cord care. That's another very popular one. And you see a lot of mothers, even on a group where you have the pediatricians present, I've seen mothers telling other mothers to put what? Toothpaste, all sorts of dusting powder and all that. Some even believe in using hot water to mop and to do that for the cord. I also want to tell you that these are very dangerous practices. I've seen babies who have suffered burns, because newborn babies suffer burns because people were trying to use hot water to massage the cord and all that. When it comes to cord care, all you need to do is to put what we call the chlorhexidine gel. That is all that is in, and you need to apply it once a day for the next 7 days, and the baby will be fine. That is all that is required. You don't need to use toothpaste. You don't need to use cow dung. You don't need to put methylated spirits or all sorts of things. We don't need to put all these things on the cord of the babies. And you also keep the cord dry and apply the gel, or if you don't have the gel, you can use methylated spirit, only that you have to use methylated spirit like every 2, 3, 4 hours, as frequently as possible, and make sure the cord is kept dry. The cord will be fine. So these are some of those dangerous practices as regards cord care that we as mothers, we need to step away from. Another very important one is the issue of circumcision, because we live in an environment where people believe that the males should be circumcised for religious reasons, for cultural reasons. And there are different options when it comes to circumcision. We have the plastibell. We also have the traditional method where there's a surgical cut, So when it comes to circumcision, usually the doctors would have told you that after that, just if it is a plastibell, you don't really need to do anything. Just care for the baby. It's going to drop on his own and the baby is fine. But if it's a surgical method, maybe they would have given you something like an ointment or just to apply. But we see a lot of mother putting things like engine oil, kerosene and stuff on the circumcised phallus, and this is what is leading to I've seen a very infected wound, all resulting from this. Another thing is that some people go to the quacks to do that circumcision, and I've seen people where they've actually amputated the whole penis, all in the process of circumcision, or the baby has bled to death. And these are dangerous processes. So I will always encourage that when you want to do circumcision, let it be done by trained professionals in the hospitals, and don't apply anything the doctor did not ask you to apply. It's going to heal on its own. All you need to do is to follow the instruction, keep it clean, and make sure that you give whatever medication you give, and that is all. And these are ways that babies get infection through our practices that are not necessary, and we as mothers, we must make sure that we step away from this. And while we are still on circumcision, some people also believe that the females should be circumcised, and this is a very dangerous vice. It's a criminal offense now, because it has been banned and it has been found out to cause so many problems for our children, ranging from bleeding, infections, and even later on in life, those children may have difficulty enjoying sexual relationships. They may have difficulty, having babies, difficult deliveries, and all that. So a newborn baby girl does not need to be circumcised, and the clitoris does not need to be massaged, because I've also had all sorts of questions as regards that the mother-in-law needs to massage it, put Vaseline, put everything. All those are unnecessary practices, and sometimes when they are doing all these things, they are introducing infections to the babies, and they are introducing all sorts of things. So I always tell mothers, when you are bathing your baby, you just bath that area, the surface, the external surface, the same way you bath the rest of the body of the baby, and there's no need to apply anything to the clitoris. There's no need for it to be circumcised as well. This is basically what we need to do, you know. So there are still many other practices that we can go on, but I guess you may want to clarify.
Yeah, I'm sure our viewers at home have learned so much. Yeah. But I want us to stop at this point and perhaps take a few questions the mothers have sent in.
Yes, thank you.
There's a question here from Chidima Okere. She says, is it necessary to use water to press baby's stomach and head?
Okay, thank you very much. The babies don't need for you to press the body. Okay, that's another practices that I forgot to mention about. You know, the mothers, especially the grandmothers, believe that when a newborn baby have had their bath, they must stretch, they must massage, they must throw up and throw the baby down and all that kind of. And I must say that this is one of the most dangerous childhood practices. Please, a newborn baby does not need any extra massage. They don't need for you to throw them up or down. Some people believe that it make them strong and all that, but this is not really necessary. And we've seen babies who can fall down all in the process of that. So please, there's no need to massage, and there's no need to do any of those. Just give the baby their bath and they're fine. Another thing people do, a very common belief, is that of the orca. You know, we have this place on the what we call the anterior surface of the baby, the anterior fontanelle, sorry, and that is a normal structure, but because in babies it's very prominent and you can see it breathing, you see that most people think, oh, that means that baby has orca or something like that, and you start seeing them applying all sorts of very corrosive materials on that. So this, or to see a baby that they've shaved their head and they put this black thing on the head, you know that they are thinking the baby has orca. And I've seen babies that black whatever they apply is so corrosive that it burns out the skin, because for a newborn, you know, that fontanelle is just, it's just the layer over it, the scalp over it is just separating the brain of that baby from the outside world. So any break in that thin membrane leads to the complete exposure of the brain of the baby to the outside world. So I've seen that before, where the grandmother have applied whatever she has applied because she thinks baby has orca, and the next thing we were all seeing the baby's brain right from, just by looking, and that baby was very ill and very sick, has to be treated for meningitis infection and all that. So what am I saying is that there is no need. That's anterior fontanelle is a normal part of the baby's structure. It's a normal part of the anatomy. You don't need to apply nothing on it. Just leave it alone. Even all these common practices of saying let's put oil, let's put a thin thread of white cloth, those ones, at least, thank God, they don't cause any harm, but they are really, really unnecessary. And sometimes when people put the oils, they put it like per second, and at the end of the day, the oil just drip down the face of the baby and cause rashes on the face. You see all the better community of rashes on baby's face. It's from the oil that you've been applying on the fontanelle that is not necessary. So I didn't say don't put oil, maybe once a day, but not that every second you have to go and be putting oil or paper or clothes or it's very unnecessary. It's a normal structure of the baby. So to the question that Chidima had from that Paediatrician group, you don't need to massage the baby, you don't need to massage the forehead, you don't need to massage the cord. Once the cord has dropped, just bath it would have turned to normal skin. Just bath it like any other part of the body, and the baby is fine. There's really no need to apply anything. And the people also, the babies, another thing babies have, since I'm on that topic, is that of what we call colic. It's a very common condition in newborn babies and up to like the age of 3 months, where babies cry and scream and all that. And you see, that's one of the reasons people practice Jaundice syndrome, and they start giving them all sorts of drugs, all sorts of medications, and some even give what we call native medication or herbal preparation. I've seen what they call kafra pelebe. This is a very common. In fact, I am a pediatrician myself, and when I had my first baby, my mom came to me, and when my baby was having colic, she was like, you have to give her kafra. I just gonna put it in water. I said, no, I'm not going to give my baby. And she was like, that's how we brought you up. And I was like, see, some of these things, thank God, God saved all of us from it. We escaped. escaped. But really, we've seen babies that these babies' organs, the liver, the kidneys are still very immature. So you go and expose them to all these very all these chemicals that are very high in metals and stuff like that. They're going to just damage kidneys, and that is why some people grow up, you start having kidney failure, you don't know what happened. It is from all this medication that we have overloaded our baby system with. So please, there's no need for you to give kafra kwelebe, there's no need for you to give anything to the baby. Just give them breast milk. Colic is a common thing. We have some drugs like Infacol that can help, but most times the baby just outgrow it, and so there's really no need for you to apply anything. There's no need for you to give any unnecessary medication or herbal medication. Thank you.
Thank you very much. There's another question here from Aujola Ajibadi. She's asking if the act of using clothes and hot lantern to fasten the healing of the baby's navel is hygienic, one. Then the second one is it compulsory?
Okay, thank you, Ajibola. So again, like I've said earlier, there is no need for you to use hot lantern to massage the cord or the navel of the baby. You know, all you need to do is to make sure that the cord is kept clean and dry. And you can use, I've talked about chlorhexidine or a gel, or you can use methylated spirit. Those are the recommended method of cord care. In fact, that is recommended for those of us in the tropical region. In fact, in places in temperate region where the weather is quite dry, they just keep the cord dry and the babies are fine. But for us, because we have a lot of bacteria and a lot of heat and humidity that make bacteria to dry, so that is why you say you should use a antiseptic, either methylated spirits or chlorhexidine, but don't use lantern. It's not necessary. And all those are practices of our grandmothers, but they are not necessary, and we should definitely avoid doing that. It's not hygienic and it's actually not necessary. Yeah. And the major risks we even worry with it for us as pediatricians is the risk for burns. We've seen many babies who have suffered burns as a result of these practices. So please avoid them.
Thank you. Philomena Johnson is asking, what of the practice of putting breast milk in your baby's eyes to cure conjunctivitis?
Yeah, thank you very much. I'm very happy to hear that question from Philomena. Okay, that's another common practice which I didn't mention in my introduction. You see a lot of mothers believing that breast milk, I appreciate the fact that breast milk is a powerful it's powerful, you can do and undo. We as pediatricians, we love breast milk a lot, and we recommend that you exclusively breastfeed your babies. But please, breast milk is food, it's not drug, it is food. So, and I've not seen where when your eyes is paining you, you go and put your food in your eyes. So when your babies have eye infection or eye discharge, please take them to the hospital and let the pediatrician or the medical doctors or GP, let them treat them. Usually most times they just require some eye drops and all that. And in fact, just using what we call normal saline and all that to clean the eyes, and you put the eye drop, the babies are fine. Please don't put breast milk. Breast milk is actually food, and what it means is that when there's bacteria and you put food, the bacteria is going to multiply. When they multiply, the baby is actually going to get worse. So don't put breast milk in the eyes. It is not drug, it is food, and it's not meant for that purpose. And we are playing with blindness here. We're talking about the eye, very important structure in the body. Thank you.
Next question, I'll take two questions together because they're very similar. Nerissa Igbolugbe is asking, can I give my 1 month old baby Gbemisola? The second similar question is from Joy Peculiar. She says, can I give my baby chloroquine syrup?
Thank you for those questions. And see, that question actually brought me to another practice, which I already said we're going to talk about, but which we have not yet mentioned. Is that use of indiscriminate use of drugs by mothers. Mothers, I salute you. You are. I always call you the first doctor in the house. You are the ones that take care of everybody. But I think we should know our limits. Okay, so I encourage mothers to give drugs like paracetamol. If your baby has fever, you can give paracetamol. You can give your multivitamins. I think that's about all. Please, when your babies are sick, don't start wearing doctor's hats and giving them drugs. There are some drugs we call prescription medication. These are drugs that a doctor must write for you before you use it. And one of them is that chloroquine, for example, is an anti-malaria, and we don't encourage mothers to use anti-malaria. But the issue is even that we don't even recommend chloroquine anymore for the treatment of malaria, and that is why you must avoid, doing that. The same thing with the person asking for Augmentin. Please do not give your baby Augmentin except a doctor has written it as a prescription. If a doctor prescribes Augmentin, why not? But if it is not a prescription by the doctor, please do not use antibiotics except it is written by doctor. If you follow us on Ask a Pediatrician, you see that we said that we don't prescribe drugs on our group. We don't recommend any drugs that you cannot buy over the counter. I know we live in Nigeria where we are so pardon me to say, I think we're so lawless when it comes to this. In other places, you can't buy those drugs without your doctor's prescription. But because in Nigeria, apologies to our pharmacists, some of them are just interested in selling the drugs. And because of that, the mother walks in, wants Augmentin, no prescription, nothing, and she's given that drug. That is actually unacceptable practice. And that is why mothers have abused drugs. Let me tell you the danger of what you are doing to your babies. When your baby do not need Augmentin, and you gave Augmentin, the time will come when your baby needs Augmentin, and when we give that Augmentin, it's not going to work because your baby has already developed resistance. That is what is happening, and it's becoming a problem. Even the World Health Organization has recognized that we're having challenge with antibiotic resistance. You know why? We don't have new antibiotics. We don't have new antibiotics. So after we've gotten to where we are now for many years now, they've not discovered any new antibiotics. It means that if we can't get any, if your baby has antibiotic resistance to the ones we have, then it's death sentence because we're not going to be able to treat that baby. So, and that's why babies come to our hospital. We give them the common drugs like Augmentin. They are not responding to them because the mother has used them already for her, and of course most mothers use them in under dosage, and I mean they also use them not for the duration or period that is recommended. They use them when it's not necessary, and at the end of the day, when baby now actually need those drugs, they're not going to work anymore. So I'm going to plead with mothers. I know most mothers are listening to me, and our fathers as well. Please don't use antibiotics. Don't use any prescription drugs except you have seen a doctor who wrote it for you. And I'm going to plead with our pharmacists and our drugs companies selling drugs. Please always make sure that we don't give these drugs except we get prescription from the mothers. We are saving our children for the future. Thank you very much. So Phenomena and the rest, please don't use chloroquine, don't use Augmentin. If your babies are sick, take them to see the pediatricians. Sometimes the babies don't even need any medication. So, and they will tell you what to do. Thank you.
Wow, I'm really learning a lot this morning. There's another question here from Shakira Jimo. She's asking, please, is it okay to give red palm oil to a child that is coughing?
Okay, thank you very much. Red palm oil. So we have some practices, some what we call local remedies. People believe in things like palm oil for cough and all. Palm oil is actually food, so it's not as if it's a dangerous. It's not something dangerous. So sometimes we doctors even recommend home remedies like that. So for them to lick, like honey to lick for children above 1 year and all that. There's nothing wrong with that. But when it comes to palm oil is when mothers overload their babies with palm oil to cause them to vomit. The act of using palm oil to induce vomiting, maybe in a child who has swallowed a wrong, maybe poisonous material or something, that is what we frown at, because in the process of inducing the vomiting, that fumes, because palm oil is hydrocarbon, is oil, it can become vapor, it can go into fumes, and it can enter into the lungs. And when it enters into the lungs of children, it's called what we call lipoid pneumonia. The children begin to have breathlessness and all that. And sometimes even after the initial reason why the palm oil was used has been sorted, then we are dealing with the pneumonia. And pneumonia, this lipoid pneumonia is very difficult to treat. Most times the children needs to be on ICU, ventilator and all that, and the children can die from that. So what I'm saying that for if your baby is having having cough and you put palm oil with a little bit of sugar and for the child to lick and all that, that may not be a problem. But please don't give them a whole cup or bolus of palm oil to swallow because you are trying to induce vomiting. That is what we frown against, and that is a dangerous practice as far as child health is concerned. Yeah, thank you.
Okay, Emanuela Obama is asking, what of the practice of putting a baby that was diagnosed of jaundice inside the sun?
Okay, thank you very much, Emanuela, for that question. So when it comes to jaundice, there are different levels of jaundice. So there's a jaundice that we call physiological jaundice, and this is a level that which even we don't do anything, the jaundice is going to go away and it's not going to cause any harm to the baby. So but there's a level of jaundice that baby needs to be under what we call for the therapy lights, and then there's a level of jaundice that we need to exchange that baby's blood, because if not, the jaundice is going to cause brain damage and that child is going to develop disabilities in future, or the child may even die. So I always tell mothers, when your baby has jaundice, don't just go and put them in the lights or put them in sun. That's not the problem. In fact, we discover for the therapy through that principle of putting, maybe the nurse discovered that when babies that are put near the windows, who are jaundice, they tend to recover faster. That's how they discover phototherapy, and we now begin to use it. So it's not the problem. But the problem is that what is the level of jaundice in your own baby? Is it a level that needs no treatment, or is it the level that needs phototherapy, or is it the level that I have to take away the blood immediately so that the baby doesn't develop brain damage? So before you start doing anything, take that baby to your pediatrician. Let the pediatrician take a sample of the blood, do the serum bilirubin. Let the pediatrician know what is the level of the jaundice, and after that she can tell you, okay, you can just, and please, not sun. When we say sun, it's not like you go and put baby in the hot sun like that. So it's the light, it's the sunlight. So just putting the baby in the early morning sunlight, not the hot burning Nigerian sun that will cause hypothermia and the baby will die from dehydration. Please don't do that. But before you even do any of those, please make sure you see your pressure. Another common practice people doing when it comes to jaundice is this pawpaw water. They believe so much that pawpaw water can cure jaundice, and I've seen many of them, because I'm a developmental pediatrician. I take care of children who have disabilities physically and mentally, and I've seen a lot of babies who develop all these disabilities because instead of the mother coming to the hospital, she was giving pawpaw water. And the grandmothers believe that once you give pawpaw water, the jaundice will clear. At the end of the day, we the babies. You see, one thing with jaundice is that the jaundice will always clear. That's not the issue. But the issue is that before the jaundice clear, as it causes damage to the brain, that is the main important. That's what we are after. We don't want the baby to be alive but have brain damage. So that is why we rush that if the SB is like above 20 for a term baby, we need to exchange that blood immediately. But if it is below 7 or 10, even just that's physiological jaundice, we don't even need to do anything, and we also monitor it, because it can be low now, it can rise later. So we need to monitor it and make sure it has really gone down completely before your baby is discharged. Thank you.
Thank you very much. Oluwaseun Alabi is asking, at what time should one stop administering Infacol?
Okay, so Infacol is a treatment for colic, infant colic, and it's just a kind of a relieving measure. It is not really like sometimes some babies take Infacol and they are still having their colic, because the truth of the matter is that colic is one of those things that babies just outgrow with time. So as long as the baby is having colic, you can give your Infacol. Then when the colic has stopped, then you stop giving Infacol. But more importantly, just know most of what baby just need is for you to soothe them, for you to hold them, snuggle them, and they'll be fine. But usually by 3 months max, most babies will stop having the colic pain, and they'll be fine. Yeah.
We'll take the last question now from Tumike Mustafa.
Yeah.
She has asked if the use of Gentamicin eye drop to eradicate hair pus is necessary.
Okay, like I said earlier on, for Gentamicin, whether it's an eye drop or is an injection, it's still an antibiotic, and every antibiotic must be prescribed by a doctor. So don't just assume it's Gentamicin you should use. If you think your child has eye discharge that is prolonged, that is spots coming out from the eyes, you should see your doctor. Any doctor, even preferably your pediatrician or ophthalmologist, just see any doctor, and they will now recommend the appropriate treatment. Maybe it's like Gentamicin eye drop, they will give. But I want us to get over this habit of mother just going to the chemist shop or pharmacy and just picking up medication and just using on our children. I personally think that I work for adults, you guys can do it, because children they can't talk for themselves, and because of that, we as pediatricians, we are the advocates for children, and we are saying please stop using medication on our children without a prescription. Make sure that is a recommend, because sometimes when it comes to medication, we need to know the dose. And the dose for children is varies from that of the adults, and it's not a one dose fit all. What I will give a 1 month old is not what I will give a 2 month old, it's not what I will give a 1 year old. And these are some of and there are some drugs that some children can react to, and once we have known that the child reacted to, we're not going to give it again, or we're not going to give drugs in that same family again. So these are all the peculiarities when it comes to use of medication. And that's why we want the mothers to think it's not as if we are trying to doctors are expensive and all that. And I will tell mothers, we have the general hospitals, we have the government hospitals. If you cannot afford private hospitals, see doctor. Most times to see a doctor in most of the government hospitals is free. You can see us for free. You can just, so why not just take your time to see your doctors, and then they will take it up from there. So these are things. Then when we are still on this topic, let me talk about the issue of tongue tie, because that's one favorite area mothers love so much. Please, there's something we call frenulum, just like the anterior frontal. There are some things that are normal structure. Maybe we need to teach the mother's anatomy. Frenulum is a normal structure it connects the tongue to the floor of the mouth, and it's just a thin membrane. It does not so it does not make your children not to talk. It does not cause any speech delay, because everybody just they must call tongue tie, they must call tongue tie. In fact, an average mother, when they come to me, they say, Dr. Boyede, they help me to check my baby's tongue. I think they should have tongue tie, and I'm saying, I'm not even bothering. I'm not going to even check, because I know your baby doesn't have tongue tie, So because I'm talking of babies that come to me because they are not talking, not the smaller babies, So please stop allowing people to make merchandise of you. And most private hospitals, because they know that's what you want, they've capitalized on it. But you see, recently, last week, we were discussing my hospital, and we are doing what we call a mobility, where we review all our patients that came in, those that we were able to cure, those that died, and all that. And I heard the story, one of the babies that were lost died because the mother think the baby had tongue tied, took the baby to a nurse. Apologies to all the nurses. I don't know whether this is one of your trained nurses, maybe it's just one of the fake ones. And they were trying to cause the tongue tie, and the baby just bled and bled and bled. I'm sure she has caused more than tongue tie. Now this time I think she has actually caused the tongue itself. And by the time they brought the baby to us in Luz, what can we do? We rushed and tried to transfuse and all that, but we lost that baby. And when I heard that story, it broke my heart. I said, this baby would have been alive if the mother is not trying to cut tongue tie. So please don't. There's very rarely do we have babies that really have what we call the ankylosing, where there's actually a very thick muscular membrane that connects the tongue to the floor of the mouth, and those are the real tongue tie. And most of those patients speak, it's not that their speech may not be clear. I know we want to do this kind of thing. They were done by the surgeons in the hospital. So all these babies that are talking, lifting up their tongue, smiling, laughing, talking, they don't have tongue tie. So doctors, please relax. Stop worried about tongue tie, and don't go and meet what do they call them? All these fake people doing tongue tie cuts, or another one they call is what they call bilubelu and all those things. Those things are dangerous things for our children. And apart from that, infection, bleeding, and those are things that are even tetanus. Those are things we can avoid rather if we don't subject ourselves to such dangerous practices.
Osei Eko just sent in her question. She's asking if it's necessary to bathe a newborn baby with palm oil.
Hey, thank you, Osei. That's another popular one. And there's some people mothers took me up on it. In fact, before we formed as a pediatrician, and the mother told me that all newborn babies will be bathed with palm oil, and this Yoruba sponge, this very ash, very ash sponge. So that thank you. And I asked her, look, are we the only people in the whole planet? We have 7 billion people in the world, and Nigerians, we are just about 200 million people. So how come all the other people that don't do this practice of palm oil and sponge of bathing the baby, how come they don't have body odor? I've seen Nigerians who have body odor, and I've seen being with other people from other countries that don't have body odor. So what I'm trying to say is that this what we call Caucasians, what we call the Igbo people in Nigeria, they don't have body odor, and I'm sure nobody bathed them with palm oil, nobody scrubbed them with iron sponge or something like that. Please, there is nothing like that. In fact, what these days people are even talking about the first 24 hours, there's no need to bath a baby. You know why? Because we want the baby sense the mother through the smell. Those things that cover that baby is one of the things the baby used to identify where the breast milk is and all that. That's why you see when most of in other countries they don't bath the baby. Well, we are lucky because our weather is quite warm anyway, so our baby don't get cold. In places where the weather is quite cold, they will just clean off the baby, and that's all. So I even say, okay, fine, Nigeria weather is hot and all that, so you can bath your baby, and once a day is enough. Because I see some mothers, they will bath the baby morning, afternoon, and I'm like, where has the baby gone to become dirty? And and then they will not be complaining that the baby is sneezing, is cold, is coffee, and all that. Remember what the babies need: breast milk, warmth. Those are the two most important things they need. So when you bath them in the morning, bath them at night, you are making them cold. And their body surface is so small, is wide compared to their size, so they can easily lose their heat rapidly compared to you that you are big and all that. So please, there's no need to do palm oil baths, there's no need to do iron sponge or whatever sponge bath. Just the normal face towel or even the softer sponge is fine. And once a day bath is enough. Please, thank you very much.
Thank you very much, doctor. Before we go this morning, I would like to ask a question. There's this practice I see. You see mothers using black soap for their babies when the babies are growing teeth. They claim that it helps.
We didn't even go into teaching. That's if you.
It helps you,
Okay, so thank you very much. I don't know how we forgot teaching in the process of this our child, because teaching is another thing mothers have magnified. Okay, so let me break it down this morning for those who are listening to me. Teaching is a natural physiological process. What do I mean by all those big grammar? Is like the same way your baby is adding weight, the same way they grow, their hands are getting longer, the same way they are getting taller and all that. That's the same way the teeth are normal structure. In fact, the teeth are already present inside. Just that they are now descending and cutting out. That's why you are seeing them. So it's a normal process. It doesn't cause sickness. It doesn't cause diarrhea. It doesn't cause cough. It does not cause ball. What else do they say teething cause? Teething does not cause anything. Teething is a normal process. It doesn't cause fever. If your baby is very sick, and I'm very happy you brought up that topic, because we've lost a lot of babies in Nigeria. Our mortality is quite high. And why are our children dying? It's because when a child is sick, the mother will not go to the hospital. It is teething. And that is why some mothers, right from day one the baby was born, they started giving teething mixture, teething powder. Some give paracetamol. Let me tell you, there is no drug that doesn't have side effects. Even the paracetamol that all of us can just take over the counter and all that, it can cause liver damage. There's a level to which you take paracetamol, it can damage your liver. And the liver is a very vital organ in the body. Once you have liver failure, that's the end. So please don't give teething mixture. Don't give teething powder. If at all you're going to have fever from teething, it won't be more than 37.8, max 38. So by the time you're getting to 39, a child who is having watery stool, it's not teething. A child who is having severe cough and breathing fast and all that is ill. You see, you know what normally happens? Let me explain why most mothers think it's teething. Because the time that babies usually teeth, that is 6 months, from between 6 months. That's when the first set of teeth are brought out. It's also the period that coincides with when the immunity of the babies begin to go low. Why? Because at that 6 months, that's when we stop doing exclusive breastfeeding. All the develop our own immunity. So that period is a very critical period, and also that's the time baby begin to sit and baby begins to take things from the floor, puts it in their mouth and all that. So number one, the immunity of the baby is going down. The inherited immunity from the mother is going down. Exclusive breastfeeding is being stopped, and the baby is not being exposed to all the things in the environment. But it's okay, because baby needs to actually build up their own immunity, and they build their immunity by this exposure. And anyway, so mothers now think that means it is teething when the baby falls sick. It's not because of the teething process itself. And if you are really aware of that process period, and you are making sure your baby is kept in a clean environment, all these toys that baby pick on the floor and put in their mouth, you make sure they're sterilized, you wash them, you sterilize them, you keep your baby, you wash their hands often and all that. Make sure your baby take good complementary food. A lot of mothers ask me, doctor, what is the immune booster? What can I give my baby? There's no best immune booster than nutrition. It's your food. You know, when you are giving breast milk, even when after 6 months, don't stop breastfeeding. You will keep breastfeeding. We're only asking you to add other food. That's what we call complementary food. And also do that. Your baby is taking fruits, taking vegetables, things that will supply vitamins and minerals. Your baby will be fine. So I'm these days I'm very happy when I come to the group and I see a lot of mothers giving testimonies of how their babies have been healthy on exclusive breastfeeding, no sickness, nothing. I'm very excited, and that is how it should be. It is not compulsory that baby must be sick. Sometimes it is through all these our practices that we create. They say so. Please don't give any teething mixture. And all of you were witnesses. If you are not, you can go and Google it. When we have all these babies developing renal failure from my Peking teething mixture saga, please, we are recommending you don't give anything to your babies. If your baby is sick, take them to the hospital. Let them be seen by the doctors. And then, so all the other things like using black soap, beads. There are not. In fact, there's one somebody posted on the group. Actually, showed me a picture of the soap, teaching soap. I said, "Wow, please, people are just trying to sell their markets, and they know you mothers. Everything goes. Once they talk your babies, you are gone. Please don't make them sell. Just leave your baby alone. They will be fine." No need for any teething mixture, no need for any teething soap, beads or anything. Some babies, when they are rubbing their gums a lot, you can give them soft teethers, soft toys for them to bite on, and that will be fine for them. But make sure that teether you sterilize it, at least daily, so that it will be clean, and that's all, and they'll be fine. Thank you very much.
Thank you. Our viewers at home, I'm sure you've learned